First, an investigation has begun in Brazil into reports that a group of hospitals tested unproven drugs on elderly COVID patients without their knowledge. Lawyers for several doctors have been testifying in the Senate this past week. They say doctors were forced to prescribe medicines touted by President Jair Bolsonaro, including hydroxychloroquine. The explosive allegations relate to a chain of hospitals which serve tens of thousands of patients in the Sao Paulo area. Well, for the very latest, we can talk now to our Brazil correspondent, Tim Vickery. Tim, what are the precise allegations here, and do we know how many people are involved?
The health plan here cited, Prevent Senior, specialises in older patients. It's grown rapidly over the last 20 years with a focus on cost control. And cost control has become especially pertinent when a pandemic strikes. A number of accusations against Prevent Senior. One is that it launched a survey of the effectiveness of these anti-malaria drugs, chloroquine and hydrochloroquine, involving 636 patients who weren't told that they were part of an experiment. They were essentially guinea pigs for this experiment. And then the health plan, Prevent Senior, is alleged to have falsified the results of this research in order to make it appear that these drugs were effective. It's also alleged that across their network, doctors were pressured to prescribe these drugs even after the World Health Organization had decided that they had no effectiveness and in fact could be entirely counterproductive. The organization is also being accused of falsifying death certificates, removing COVID as a cause of death. And Bruno Morato, who's a lawyer for some ex-doctors of this health plan, hints that there's a corporate culture where the death of the patient has been seen as more financially advantageous than prolonged intensive care. So if these accusations are founded, it shows writ large the conflict of interest of private health, and it is a desecration of the Hippocratic Oath.
I mentioned President Jair Bolsonaro a little bit earlier. What can you tell us about what his apparent role in this may have been?
Well, Bolsonaro cited last year the results of this allegedly falsified survey, boosting the benefits of these anti-malaria drugs. In fact, Bolsonaro maintains his view that these drugs are effective. And Bruno Morato, the lawyer involved, she's talking of a pact between Prevent Senior and the Bolsonaro government in order to promote these anti-malaria drugs. She's talking of a pact with the ministries of health and of the economy, because if these drugs were to work, they're relatively cheap, and that gives a reason for the economy to be kept open. And that was always a priority. It's always been a priority of the Bolsonaro government that the economy be kept open. There's also, it would seem that there was a hope in the Bolsonaro government that using these drugs would buy a little bit of time and that COVID would go away of its own accord. The 11th of December last year, President Bolsonaro said that the pandemic was right at the end. At that point, the death toll in Brazil was about 190,000. It's now over 600,000. And the only thing which is bringing that down and bringing the situation under control is mass vaccination carried out by the public health system. And this seems to be an outcome that the government and private health schemes wanted to avoid.
Tim Vickery for us there on the programme. Thanks very much indeed for reporting for us there.